Okay, so it's 6 o'clock. We're going to get started. Good evening, everyone. Welcome to our joint webinar with the Department of Social and Health Services and the Department of Corrections to talk tonight about the less restrictive alternative housing in Tenino. I'm Tyler Hemstreet. I'm with DSHS, and I'm your moderator tonight. So this is a rundown for tonight's event. I'm going to go through it briefly. We're going to open with some remarks by Kevin Bovenkamp, DSHS Assistant Secretary of the Behavioral Health Administration. We're also going to hear from Mac Peavy, the Assistant Secretary for the Community Corrections Division with the Department of Corrections. The presentation portion of tonight's event will feature DSHS staff from the Special Commitment Center, and Department of Corrections subject matter experts will also present tonight. Now, just some housekeeping items. We will not be using the hand raised function during this event. We will be taking questions through the Q&A function only. So if you can please pose your question there, I will address them. Thank you again. And we are going to go for an hour solid, but this is going to be somewhat time limited, but we are going to try and get to as many questions as we can tonight. So with that, I'd like to introduce Kevin Bovenkamp to say a few words.
Thank you, Tyler. Good evening, everyone, and thank you for your attendance. My name is Kevin Bovenkamp, and I'm the DSHS Assistant Secretary for the Behavioral Health Administration. We are grateful for the large turnout tonight, and we do look forward to a productive evening of sharing information and discussing concerns. We recognize many wish this would have been an in-person community meeting and last weekend rather than a virtual format, but we did make a decision based on our concerns about staff and community safety to not do an in-person one last weekend, and we won't be talking about that in further details this evening. We do care about our communities that we all share, and we do hope to hear and learn a lot from you in this process this evening. The Special Commitment Center and program fall within the DSHS Behavioral Health Administration. And before I turn it over to Mr. Peavy, I'd like to get some important information out to you that's responsive to many of the questions we've been receiving thus far. One of the most important pieces of information is first that the LRA resident did not release to the proposed residents today. That release has been paused for the time being while the property owner and the county discuss the concerns raised related to code compliance for the property. The issues related to code compliance are between the property owner and the county, so we won't be discussing those further this evening as well. And then lastly, there is no plan to close the Special Commitment Center on McNeil Island and release everyone to the community. While LRA cases like this one do transition out to the community per the civil commitment laws, other new cases are sent to the program by the courts, and McNeil Island will continue to operate. Thank you for your time, and with that, I'll turn it over to Mr. Peavy.
Thank you, Mr. Bovenkamp, and good evening, everyone. Thank you for being here. My name is Mac Peavy. I serve as the Assistant Secretary for the Community Corrections Division within the Washington State Department of Corrections. DOC's Civil Commitment Program, which provides services for individuals who are under the jurisdiction for civil matters and commitments, to include less restrictive alternatives, falls under my division. We monitor all residents in less restrictive alternatives across the state. And tonight, we will detail the extensive steps we take to ensure communities are safe in these situations. By way of background, the Department of Corrections Civil Commitment Program was established in 2012 to provide consistency with monitoring and transition of individuals in a community setting. Residents are under the jurisdiction of DSHS and receive supervision from the Department of Corrections per a court order. The DOC Civil Commitment Program staff's responsibility is to conduct site investigations, followed by a report to the court, and to provide supervision and monitoring of court order conditions per statute, specifically 7109. The Civil Commitment Program works collaboratively with our partners at DSHS, and specifically the two state hospitals and the Special Commitment Center, This evening, we'll discuss and you'll hear information about structure of the department's civil commitment program, the process of conducting release investigations, development of recommended individualized supervision conditions for the LRA placements in the community, supervision strategies and activities to mitigate risk, participation as a member of a multidisciplinary case management team, the utilization of various equipment and technology for the purposes of monitoring the residents. And then lastly, responses to violations and our reporting obligations to the court. Thank you again for being here and the opportunity to share some information with you this evening. And with that, I'll turn it back over to Mr. Hemstreet. Thank you.
Okay, thank you, Mac PV. Okay, so now we're going to start the presentation portion of the event. Just a reminder, if you do have a question during the presentations, or if you think of something, you can type it in, and we will get to that during the Q&A portion. So to kick off the presentations, I'd like to introduce Mr. Keith DeVos. Keith.
Good evening, everyone. My name is Keith DeVos, and I am the Chief Executive Officer for the Special Commitment Center.
Good evening, everyone. I am Candace Yee, Chief of Transition and Program Accountability at the SEC.
Next slide, please. So our objectives tonight is to discuss the civil commitment process overview, give everyone a little bit of idea how it works, how SEC residents are released, both conditionally or unconditionally, where SEC residents are conditionally released. So there are a number of different types of less restrictive alternative housing options available depending on the resident's needs. We're going to talk a little bit about some of the court-ordered conditions of release. We'll discuss briefly the law enforcement notification and how the public becomes aware of a resident being released into the community. And then we'll talk a little bit about our resident community transition teams, which is the team that supports the resident while in the community. Next slide, please. So I want to begin by saying that civil commitment is not an extension of a prison sentence. McNeil Island is not a prison. What we do on McNeil Island is we provide inpatient treatment in a secure setting. It is a highly secure setting, but it is still a treatment facility. Residents don't come there and remain there indefinitely. In order for the program to remain constitutional, a resident must have the ability to have a pathway back out into the community. So every resident that comes to SCC meets the criteria, meaning that they are diagnosed with a mental abnormality, making them more likely than not to reoffend if released into the community without the benefit of treatment. The pathway into SCC is through the court, so we receive them through court orders, and the pathway back out is through the court and through a court order. SCC does not have, nor does DSHS have the authority to release anybody into the community. Residents who reside at the SCC receive evidence-based sex offense treatment. So each resident has an individualized treatment plan based on their needs. And then our treatment team assigns them different groups to attend to address whatever their needs are. Additionally, every resident is required to receive a forensic evaluation. So the forensic evaluation is completed by a forensic psychologist. So this is a PhD level psychologist, and their job is to determine whether or not a resident continues to meet criteria of an SVP or has so changed that they no longer meet criteria. Residents who continue to meet criteria then may be considered by the forensic evaluator to determine whether or not going into the community to extend the treatment that they've already started in McNeil Island is to their benefit. So, can they practice the skills that they've learned in total confinement, and can conditions be established to ensure that the community remains safe? So these reports are generated every year, and they are forwarded to the courts for their consideration. Next slide, please. It's important to note that a resident can petition the court at any time with or without support. So when a resident petitions the court, the judge may order the SCC to conduct a less restrictive alternative plan. So this is new work that has been assigned to SCC with the implementation of the new statute that was placed into law the last cycle. And it now requires SCC to develop these less restrictive alternative plans. This is new work that we had not historically done before. One of the requirements is that we consider fair share principles when developing these less restrictive alternatives. And how that works is we first must consider, when looking for a placement, where the resident was civilly committed from, and if housing is available in that county of commitment. If it is not available, then we must consider fair share in identifying a housing option in a different county. And so what fair share means is that each county in Washington state has adequate options for conditional release housing placements in a number generally equivalent to the number of residents from the county who are subject to total confinement. So the way this would work for Thurston County, for example, is Thurston County has 9 residents in our program. 7 of those residents currently reside on McNeil Island, and 2 of those residents reside in Pierce County, and they are on a conditional release into the community. Once we complete the plan, we have to submit that plan to the court. That has to be completed within 90 days. The court may then direct Department of Corrections to conduct an investigation into that LRA home. And they will be speaking a little bit more in depth about that when they provide their presentation. DOC has 60 days to turn that report in, and then the judge will consider all of the evidence and information provided to them. So this would include the forensic evaluation, the DOC investigation, any expert testimony that is presented, any treatment information, everything that the judge needs to make a determination about whether or not the LRA placement is appropriate for the resident. If the judge determines that it is, the judge can then order the resident to release to this LRA home. I want to point out too, and this is really important, so every resident does have a defense attorney team that supports them. And so they are also able to develop LRA plans separate from the SCC. And this is actually very good because everyone is entitled to a defense. And so the defense attorneys are ethically obligated to develop these plans as well. Sometimes you'll see more than one plan presented to the court. Sometimes a single plan will be agreed upon, but it is good for the resident to have those options so that the best possible placement can be developed. Next slide, please. At this time, I'd like to turn it over to Ms. Yee.
All right, thank you very much. Good evening again. I'd like to take a moment to explain the various types of settings that are considered less restrictive alternative placements in hopes of providing better understanding of transition discharge placement options. It's important to note that while the term LRA is used interchangeably to describe a placement, it is more accurately defined as a court-ordered treatment in a less restrictive setting than McNeil Island, also referred to as total confinement facility. LRA options primarily fall under 3 types of settings to include secured community transition facilities, staffed housing, and independent housing. The state currently owns and operates 2 SCTFs. One is located in King County and the other in Pierce County. Staffed housing reflects a supportive living type residence that is owned and operated by contracted or non-contracted housing providers. These homes are staffed with employees procured directly by the housing provider. On the other hand, independent housing are more akin to apartment type living or group home settings, generally individuals living on their own, with minimal to no staffing within the residence. And just quickly, as a last point, and as you can see on this slide, it is important to delineate that not all staffed and not all homes are contracted with the SCC. And in fact, the majority of homes currently occupied by residents in the community reside within non-contracted homes. Next slide, please. I'd like to now draw your attention to law enforcement notification. Law enforcement notification is rightfully a significant interest to many. I'd like to be clear that the law requires the SCC to provide notice to law enforcement no less than 30 days prior to the approved LRA location. In turn, the Sheriff's Department has the obligation to determine in what manner this notification is provided to community members at large. We would like to stress that we take the notification process seriously as it is dictated by law. Next slide, please. The Resident Community Transition Team, known as the RCTT for short, plays an essential role in the oversight, management, and monitoring of residents in the court-ordered, for those court-ordered to the community. Each resident is assigned to a team, and this team is comprised of a DOC corrections specialist, a state-certified sex offender treatment provider, and this individual, as a note, is a private practitioner and not a state employee, and a master's level clinical social worker from the SCC. Next slide, please. This group is responsible for monitoring community safety, treatment progress, and residents' compliance to court conditions. This group has the authority and responsibility to approve when and where a resident may go in the community, who a resident is allowed to communicate with, what requested items they're allowed to have in their possession, amongst other individualized requests that may arise in the course of their treatment. Independently, each of these individuals also have their own expectations for engagement with the resident. And as an example, the SCC social worker will meet outlined expectations for face-to-face contact and interfacing with individuals and remain involved in whatever capacity is warranted and needed. So in essence, the RCTT serves as an added layer of resident and community safety. And with that, I would like to take it back to Tyler. Thank you.
Okay, thank you, Candace. Thank you, Keith and Candace. Okay, so now we're going to hear from Donta Harper and Brandon Duncan with the Department of Corrections. So Donta, take it away.
All right, next slide, please. All right. Good evening, and thank you all for joining us for this discussion today. I am Donta Harper, the Regional Administrator for the Northwest. I am also responsible for the Civil Commitment Program, and Brandon Duncan and I will be discussing DOC processes. Brandon, could you introduce yourself, please?
Yes, thank you, Dr. Harper. My name is Brandon Duncan. I am the Civil Commitment Program Manager. I oversee the specialists who supervise the less restrictive alternative placements in the community.
Thank you, Brandon. Next slide, please. As Assistant Secretary Peavy mentioned in his introduction, the Civil Commitment Program has been in existence since 2012. Today, the program has 13 community corrections specialists that are responsible for monitoring LRA cases across the state. These specialists are on what we call standby status. They are able to respond to residents in incidents 24/7. They have a caseload size of about 10 per specialist. The specialist team collaborate and work with law enforcement, treatment teams, and DSHS to ensure compliance with the LRA conditions as ordered by the court. This team also participates in conducting investigation reports, pre-sentence or pre-transition meetings, end of sentence review processes, notification process, and they also participate on the community residential transition team. Specialists currently supervise 86 cases across the state. And these counties include King, Pierce, Spokane, Walla Walla, Snohomish, and Kitsap County. Now I will turn it over to Mr. Duncan, who will discuss in further detail the work that the Civil Commitment Program does. Next slide, please.
Hi, good evening again. My name is Brandon Duncan, Civil Commitment Program Manager. I would like to go over some greater details in what's already been presented. I also want to say that I'm very encouraged about the amount of participants in this webinar, and I really hope that we are able to answer some of the questions that may be out there. So before the court orders any kind of conditional release to a less restrictive alternative, the Department of Corrections is ordered to complete a report, which is called an investigation report, within 60 days. DOC does not approve or deny the placement in the process of this report. DOC provides information and recommends conditions. We call this report a court special, and it has an interview with several people, the resident and the treatment provider at the very least, and others as needed to provide to the court what they need to make a determination. There's a detailed description of the land and property in the neighborhood, which would be what the house looks like, how many rooms are in it, what the property design and distance are, and what kind of environment is surrounding it. So the housing provider program is also outlined, and we outline that through a process of interviewing the housing provider and putting that into the report. We list a bunch of areas around that could be risk concerns, like schools, parks, playgrounds, transportation, victims, witness, and other things that come across in a fairly comprehensive list of the proposed location. We include a community treatment plan, which is a requirement from the law. We also include anything that could be community supports within the environment around them that the resident can use to support their progress. Conditions are recommended by the specialist to include a global positioning system, which we call a GPS, monitoring requirements. And we also provide residential supervision, treatment, standard and special conditions. Next slide, please. We do participate in part of the notification process at DOC. What we are part of and facilitators of is the end of sentence review committee, which is a multidisciplinary team that comes up with the sex offender level. What they do is they review criminal, psychiatric, risk evaluations, treatment history, and other things, and make a recommendation to the Sheriff's Department of what level they believe that the person should be placed at. And then ultimately the Sheriff's Department determines what level they want the person registered at. DSHS presents a drafted notification in ESRC, and that is also forwarded to the sheriff within that 30-day timeline that was mentioned earlier. And DOC also supports additional notification processes upon invitation by the Sheriff's Department or others. Next slide, please. So, supervision process. DOC ensures compliance to the individualized court-ordered LRA conditions. That is the court order that explains exactly what the resident is to do on the LRA and what they're required by the court to participate in, and what restrictions and conditions are placed upon the resident. Before the resident leaves the island, before they step ground into the community, they have a GPS installed, and all of the safety elements are established prior to that moment. Then they register with the local sheriff's office before they come to DOC, and DOC goes over all the conditions and requirements that are reviewed. And the GPS is monitored through a couple of different processes. We have movement restrictions and curfews that are established. We have site surveys to make sure that they can only go to the places that they're allowed to go to. And we have itineraries that we present to WASPIC to make sure that the GPS notes when they're supposed to be where they're at, And we also approve contacts and chaperones. They go through a vetting process, and we ensure that they can only contact the people that they're allowed to contact through the process of the residential community transition team review. Next slide, please. In addition, the specialist has a few other roles. They participate in regular meetings with the treatment team or the residential community transition team. They conduct a number of face-to-face and home community visits where they maintain regular phone check-ins. And what we mean by that is when a resident leaves their residence, they throw us a call. When they get to their destination, they give us another call. When they leave their destination, they give us another call. When they go back home, they give us another call. It's called a point-to-point process, and that's one of the ways that we monitor. We also conduct random drug and alcohol tests. We monitor and regulate internet-capable devices. And how that's done is through a software that allows us to not only monitor what they're looking at, but we can adjust the functions of those devices so that they can only access what we have approved for them to access on the internet. And important to note, we are authorized, the corrections specialist is authorized to immediately return a resident to total confinement upon any sign of a risk to the community or a safety concern. The treatment team and the specialist report violations to the court. So any violation of all of the 50 or 60 that are listed in the court order are given to the report and to the court through a report. And then the court conducts a violation hearing. The result of that hearing could be a modification to the order. It could also be a revocation entirely. And what I mean by revocation is that the LRA doesn't exist anymore for that resident, and that resident is in total confinement, and the court order is expunged, and they are not on an LRA anymore. Next slide, please. So violations and escapes. The treatment team generally, the treatment team will address violations as they can with a few different options. And those options are not limited to, but include return to total confinement, some form of movement restriction, or just staying at the home and not leaving until we figure out how to address what it was that occurred, restriction to the residents, or a treatment assignment. And the treatment assignment would be directed specifically at what the behavior was that caused a violation in order to try and find a way for them to be successful later and not do that thing again. The DOC specialist also has independent discretion for returns and restrictions based on safety concerns, as I listed before, and that's per the law. So escape from LRA, we have a standard operating procedure for escape from LRA that's fairly robust and includes the specialist verifying and trying to attempt and locate the resident. Our GPS system works in real time. So if there is any intentional, accidental, or environmental issue with the GPS, our specialist is notified immediately and has to respond immediately, 24 hours a day, 7 days a week. And through that, if they find that the GPS is not working, they have to find this resident immediately in real time. If they aren't able to locate the resident in a prompt manner, they'll immediately contact law enforcement, and the DOC fugitive apprehension teams are immediately notified. And we also enter a warrant right away into the system. We also start identifying resources immediately, and we set up a structure of response that includes other individuals that we can use to help us find, apprehend, and return this resident into confinement. Escape from LRA can also result in a new felony charge. Escape from LRA is a felony. So if somebody escapes, they can be charged with a felony, taken to court, and potentially convicted. Next slide, please. So we have a few resources for you. We've got the law 71.09 that I would encourage people who would like information to review. We also have a website, DOC website, in which you can find a lot of different information to include contacts of individuals that you may want to contact And the DOC Victim Services Program is a toll-free number that can be contacted anytime by people who have concerns. And with that, I will hand it back to our moderator, Tyler. Thanks, Tyler.
Brandon, Dante, thank you. Great job. Okay, so just a reminder, everybody, we're not using the hand raise function during this event. We will be taking questions through the Q&A function only. So again, just continue to pose your questions there and I will address them. So with that being said, we will get to the Q&A section. We had one earlier asking about the resources in the contracted house, and Brandon touched on that pretty thoroughly during his presentation. But this one says, if there is no one on site, no one monitoring the cameras, and it takes 2+ hours for the sheriff to come out for a call, what is protecting the children and people around the home? So Brandon, can you just kind of summarize what you had said as far as response goes and collaboration with the sheriff and the team that's on standby for an incident like this?
Yeah, sure. I can go into a little bit more detail. So let me just guide you through the process here. There's an alert. The alert goes directly to the specialist in real time, and they're told something is going on. If it is a strap alert, that means the strap has been cut, the GPS is not working. There can also be a GPS is not working. They immediately respond to that and start a process of locating this person. If they decide that they cannot locate this person through a phone call, through talking to the placement, through talking to any other individuals in a very brief period of time, they will call law enforcement immediately. They will also notify a supervisor or someone who will take control of the incident. The person who takes control of the incident will start finding resources to include law enforcement information from other parties and start designing a system in which we have all of the people identified who are helping in the process, and we're moving more and more towards apprehension. That process continues in identification of resources until we apprehend the individual and we have them in our custody.
Excellent. Thank you.
Tyler, if I could add one more thing to this.
Please.
So this particular LRA, this contract does require someone to be in the home supervising the resident 24 hours a day, 7 days a week. So at no time will the resident ever be home alone. Whenever the resident leaves the house, the resident will be chaperoned as well. So there will always be someone with the resident 24 hours a day.
Okay, thank you, Keith.
I'm sorry to interrupt. I thought I'd mention one more thing as well on this. There are things we call exclusion and inclusion zones that are put into the software for the GPS. And what that means is that there are places that the person can go and places that the person cannot go. If they leave the property, that is a place, and they leave the property at the wrong time, they're not allowed to do that. And we're notified of that. And those exclusion zones and inclusion zones are also located in their routes of travel. So there's places they can go and there's places that they can't go. And if they're where they're not supposed to be, then we get alerted.
Okay, excellent. Let's see, I'm going to go through some of the questions. Here's one that had come in through our email address. I'm wondering if the residents of this facility have been determined to be rehabilitated and returned to the wider community, or are they being moved because their current facility is being closed? I think we addressed that early on, but Keith, maybe we can talk about the process to, again, go to the wider community and what that looks like.
Sure. So has the resident been rehabilitated? No, the resident continues to be is continuing treatment while in the community. So they are assigned to a certified sex offense treatment provider for continued sex offense treatment while in the community. And these providers are certified by Department of Health to provide sex offense specific treatment to the residents. So they are continuing to develop their skills that they learned in total confinement, so that if a court does unconditionally release a resident, that a resident has the skills to be safer in the community. So this LRA actually gives them the opportunity to practice the skills that they're learning through treatment.
Thank you, Keith. Okay, so we have another question in the chat. Keith, this one's for you. What is the rate of reoffending once these predators are released into the community?
Sorry, my unmute didn't want to unmute. So we have never had a resident on conditional release be convicted of a reoffense, of a hands-on reoffense. So this program has been in existence since 1991. We've had residents in it going into the community for more than 2 decades, and we have never had a resident on conditional release reoffend.
Thank you. Keith, this is for you and probably Brandon again and DOC. Dante, you stated that GPS tracking is recommended. However, the Department of Health or DOH website says that it is required, not recommended. Which is it? And how often does the GPS update?
Did you want me to grab that one, Keith?
Yeah, Tyler.
Yeah, you go ahead, Dante.
No, I would say Brandon.
Yeah, I'll cover that one. So the law requires GPS to be applied to all residents on LRA for the entire duration of the LRA. And there's another part to that question that I missed. Oh, how often does the GPS update?
Oh, right.
That was the question. Okay. Yeah. Continuously and constantly in real time.
Excellent. Okay. Okay. Keith, can you talk a little bit about how long the chaperones are trained before working at the home, and what that interaction looks like with residents?
Yeah, actually, I want to hand this one off to Candace. This is an area that she focuses on. So Candace, can you please take this one?
Sure. So it depends from house to house, but for this particular home that is of interest, they do 3 days of training. That doesn't mean that the SCC and DOC do not do additional training that's necessary to provide that oversight.
Okay, thank you, Candace. Okay, so this question has to do with some of the notification piece. And Keith, I'm going to ask you just to talk a little bit about the timeline as well. Why wasn't the community notified of this proposed LRA prior to 3 weeks before opening?
So the law enforcement notification for this LRA was sent out in mid-December to notify the law enforcement, including the sheriff's office, that this resident was going to be releasing. And so it is the responsibility statutorily for the sheriff to conduct the community notification. I do think in this case there was a transition between the sheriffs, and so it is likely that the new sheriff did not or was not aware at the time of this law enforcement notification.
Okay, thank you, Keith. Keith, this one's for you as well. We talked about McNeil Island is not closing, just to revisit that. If McNeil Island is going to remain operational, why can't these residents remain on the island in homes that could be set up there on the island as a less restrictive alternative? it is secure and the state already owns it.
Right. So the McNeil Island hosts the total confinement facility as well as one of the two secure community transition facilities. There are no other homes available on the island. There would be no other LRAs available there. And so that's why they cannot remain on the island. There's nowhere for them to live.
Okay, going back, this is again a process question, Keith. This is going to come to you. When the resident is not on LRA anymore, what happens to him or her? So maybe if you can talk a little bit about the process there.
Well, so if a resident is not on LRA, that either means they have been returned back to total confinement, or a resident has been unconditionally released by the court. So when a resident becomes unconditionally released by the court, the resident is free. They may have some additional community supervision by DOC. That's possible. It is the case in for some residents, but not for all. But once they are released, they're released.
Okay, and along those same terms, I know we talked about it. We have not had a hands-on offense since doing this since 1991. We want to talk a little bit about how many people have been who have been placed in an LRA have reoffended. I know we might not have the exact data, but if you can talk in general terms about that, Keith.
So again, we have had no residents reoffend. There's been no convictions for a hands-on reoffense. I am aware of one resident being charged with getting into some stuff on the internet. That resident was quickly returned to total confinement, and new charges were filed. I'm not aware of others on conditional release.
Okay, this is a question for corrections for Brandon and Dante. You as well, Keith. How many residents in LRAs have escaped, and how soon were they captured? Do we have that data available? And keep in mind, if you send your question in with a data specific answer like that, we can and will find that answer for you, but it may just take us a little bit of time. You know, we're pretty sure that that data might not be readily available for tonight, but we will get that answer for you. But Keith, go ahead and chime in on that.
So residents that escaped. So we had one resident who walked away from their LRA. That occurred out in Spokane, and I think DOC can talk about what that response looked like.
Yeah, so this resident cut their strap. We got a strap alert in real time. We activated the process we were talking about. We found the person within about, I want to say a mile, with maybe a half mile from where the person was. Well, we found them, and I believe it was no more than a couple of hours, and he was sitting on the sidewalk. We picked him up, apprehended him, took him back to the total confinement, and referred to the criminal prosecutor of that county for felony escape charges.
Tyler, this is Dante. Over my time over the program, which has been the last 4.5 years, we've only had the one.
And I can actually confidently say too that since the inception of LRAs in 2012, that is the only one. We have that data, so it's just the one time.
Okay, so we have a question about how many total community LRAs are expected across the state? I guess, Keith, this is for you. Once this program is fully executed, I'm not exactly sure what that refers to, but maybe if you could just talk in generality, Keith, as we continue to work with fair share principles and going forward there.
Right, so it's difficult to determine how many LRAs we can expect to be established across the state. It depends on residents' progress in treatment and how many are released into the community by the courts. So our obligation is to establish LRAs in counties of commitment so that residents can ideally return back to their county commitment, and if not, they can be placed into an LRA home in a different county without creating a disparate amount of LRAs in any one county. So it really depends on residents' progress in treatment and how many residents are released into the community.
Okay, thank you, Keith. So the next question is about the provider directly, and I'm thinking maybe we could just talk in generalities if we don't know the exact answer to this. Supreme Living has job postings for the Tenino location requiring that the employee is currently in recovery. Does this mean they're able to hire sex offenders to monitor the SVPs placed into the LRA? Candace, that sounds like a question for you.
So when we contract with individuals, the SEC is required to complete a background check in accordance with our background check policy. And I will just say that these issues did not arise.
Okay, I know, and I have talked with reporters about this as well. How much research about the internet? So Brandon, maybe you can address this. As far I know, folks are concerned about the internet connectivity with the GPS bracelets and what internet connectivity in a rural area can do as far when it comes to the GPS bracelets and how that affects a response. Residents have said that the internet service in the area is spotty at best.
Yeah, the internet and Wi-Fi has no impact on GPS function. GPS is operated based on cell, satellite, and landline.
Okay, thank you, Brandon. Let's see. We did go over notification. Keith, can you touch on that one more time? When did we inform Sheriff Sanders about this sex offender placement?
So again, we provided law enforcement notification in December. We had a conversation with Sheriff Sanders a couple of weeks ago where we were able to talk a little bit more in depth about the program and about this particular LRA. I think it was about 2 weeks ago.
Okay. Brandon, Dante, this one is for you. Where is the DOC specialist located? Is it near the LRA? And a good question, are residents allowed to freely access the entire property?
Yeah, and Tyler, I'm gonna let Brandon answer this, but what I will say back to my earlier conversation where we have cases at those 86 cases across the state, King, Pierce, Spokane, Walla Walla, Snohomish, Kitsap counties, or where we have cases at, and that's primarily where our specialists are. But Brandon, can you provide just a little bit more detail, please?
Yeah, to be specific, the specialist is in South Pierce County, so a little bit north of Tenino. There was a second question though, and can you repeat that? I feel like there was 3 questions in there actually.
Absolutely. Yes. Can you talk about if the residents are allowed to freely access the entire property, and how would a buffer be set up, or how would the GPS system be set up for that?
Yeah, I can speak to the GPS portion of that, in which we do set an exclusion and inclusion zone. Again, what that word means is that there's a perimeter around the property. If they leave that perimeter, that is excluded. If they're within the perimeter, it's included. So that's where they can go. In terms of their access to the property, I think that that's a question for potentially DSHS to talk about in terms of how that operation goes.
Actually, hold that thought, Keith. There is a question for you. We've had residents show some concern about this being next to the playground and the ski lake. This question, if your intent is to rehabilitate these SVPs, how would placing it within eyeshot of a ski lake that hosts summer camps all summer long and within the neighborhood of 35 small children be ideal? Surely there are better locations for this. Who oversees the placement of LRAs besides those who are interested in making money, such as Supreme Living? So Keith, can you address the court's role in this and in choosing?
Sure. So to address the playground, so the playground is new. The playground was not there at the time that the investigation was conducted on the house by Department of Corrections. The question about the court and kind of how the rehabilitation piece works. So the court takes all of this information into consideration. So when the report was presented to the court, the ski lake was identified. The court is aware of the activities in that area, and based on court conditions that they established in the court order, they believe that that house is suitable for that resident to reside in while continuing their treatment in the community.
Tyler, if I may just add on a little bit to what Keith is sharing. In the court report, the specialist identifies everything that he or she sees as problematic. So if the playground was an issue, they would identify it in the report. They would identify, like Brandon has said, the layout of the residence, the neighborhood the resident sits in, any parks or anything near the residence. We notify the court in that report and give that report to the court to make the decision.
Thank you, Dante. Okay, so we have another question. Keith, this is for you. This panel is referring to the resident at this location, single resident. There will potentially be 5 to 6 residents at this LRA. Please address for us, will there be one chaperone per all 5 residents? Oh, Candace.
I can go ahead and take that question. So staffing is dependent on the number of residents occupying the home and the requirements outlined in a court order. Sometimes, not sometimes, oftentimes that drives that. There will be at least one staff member with the resident all day should this occur. At no point in time, and I believe Keith had already stressed that, will the resident be left alone. And I will say that there are in-home staffing and there's a separate chaperone staffing. So I hope that answered the question, but staffing is largely dependent on the individualized needs of that resident.
Thank you, Candace. Keith, this one is for you. And I was hoping that you could talk in general about 5163 as well, because this Senate Bill 5163 and what it does for this process. Keith, can you speak to the bid process for a private contractor seeking to establish an LRA? Are bids required to be competitive, and was Supreme Living awarded without competition?
Okay, so to speak to that specifically, so we posted on webs on August 31st of 2021, requesting bids for these less restrictive alternatives. We received no bids. We continued to post and attempt to identify contractors up until April of 2022 and continued to have no responses for anyone interested in developing a LRA home for our program. This particular contractor is known to DSHS, is a contractor that has a contract with another program. And so that was how we came into contact with her. And then she had a home and she was interested in contracting with us. And so that's how this contract came about.
Okay, thank you, Keith. So that's what we were referring to. Looks like there's some confusion. People said this program has been in existence since 1991. I believe the Community Safety Protection Act has. Then this is a brand new situation due to the law change. So Keith, can you just kind of in general terms talk about what the law change did?
So the change in the law moved some additional responsibilities to the department. So one of the responsibilities is to attempt to identify LRA homes considering fair share. So looking for homes in counties that have residents that are committed to our program, but don't have LRA placements available in them. An additional change, and I talked about it a little bit earlier, was the responsibility now to develop these less restrictive alternative plans. So this is new work that we have not done in the past. We were given the resources to do it. And so we are now developing these plans only when court ordered to do it. And then the other part that we're responsible for, again, is the fair share. So we are responsible for considering fair share when developing these LRA plans to ensure that we're not placing all of the residents into one single county, but we're spreading it out based on other counties that have residents within our program.
Okay, thank you, Keith. So Candace, I'm going to ask you this next question. What does a daily activity for a resident look like in an LRA home? What are the residents doing?
Okay, thank you for that question. Again, it is individualized. So this is ongoing treatment in the community. This individual will meet with their certified sex offense treatment provider and oftentimes do have things that they are currently working on. I would like to mention that a lot of these individuals, because of being institutionalized, for lack of a better term, do need to also develop skills that would enable them to be more successful in the community. And it could be as mundane as learning how to cook a meal, learning how to fill out a resume, learning how to communicate appropriately, cleaning up after themselves. As mundane as it seems, these are skills that we do emphasize and that do contribute to successful integration back into the community.
Thank you, Candace. So Keith, this is probably a question for you. Maybe more with HIPAA, but is an individual residence program and restrictions made available for public review?
So the residence restrictions are going to be identified in the court order, and I do believe court orders are publicly available.
Okay. So we have another question about escorting residents to their off-site appointments. That I guess that would Brandon or Candace, can you talk about the chaperone's role again?
Was that a candidate or
I'm sorry.
Okay.
I'm gonna lump another
Yeah,
question.
go ahead.
Yeah. And we have a question about the chaperone training. I think you touched on it, Candace, and Brandon also. And I think we talked also about specific routes, specific times. So Brandon, if you can first revisit about chaperones, specific routes, and those roles, and then Candace, if you could just talk one more time about the training as well.
Yeah, sure. I'm sorry, I wasn't understanding. Also, I want to just say these are all really, really good questions, and I'm glad that we have the opportunity to answer them. I'm encouraged that so many people are interested in getting this information and that we're able to provide it. In terms of the chaperones will travel with the resident into the community, and they will be told from DOC where they're allowed to go, where they're not allowed to go, and their approved routes of travel. There's also some information related to the person's offense history, what their risk factors are, and some additional things. Candace is probably a better person to talk about the specifics of that chaperone training, but there are elements that DOC participates in when that's happening.
Sure. So chaperone training is currently done in partnership with the Department of Corrections, and it's provided to the housing providers as well as any other staff that may be involved in chaperoning individuals back and forth from one placement to another. And it does include like what to do, how to intervene in case of an emergency. And so it's a fairly robust and comprehensive checklist of things to keep in mind as you are out in the community with the resident, and it covers all potential situations that could potentially occur.
Thank you, Candace.
And then
So,
if Keith wanted to add any more to that, I'd be open to that as well.
No, I think you got it.
so it's now 7 o'clock. We continue to have folks submit questions. There have been some repetitive questions, so I'm doing my best to cover some of the things that we have not talked about. But again, I want everybody on here to continue to type in those questions, and if we don't get to it, you can still submit them on our SCC email that was in there. And after this as well, we will have a frequently asked questions that will be posted on our SCC site if it's not up already. Anita, do we know if it's up already? But
that is up already.
Okay, that is up already. So Anita will post that website link in there. So we're going to go for another 15 minutes. And like I said, I'm going to try and get to questions that we have not been asked. And I apologize if people are coming in and we may have touched on some of these earlier, but we'll do the best we can to continue getting there. So this is, Keith, this is probably a question for you. What is the criteria for selecting residents for this LRA program? If the state has a compelling interest to commit these individuals and continue to state tracking and care because of the high risk of reoffense, why place them within reach of potential new victims?
So the criteria to come to the Special Commitment Center is outlined clearly in the statute. So a resident has a mental abnormality that makes them more likely than not to reoffend. When they come to the Special Commitment Center, they are here again to receive treatment. Selecting residents go out into the community. We don't select residents that go out into the community. That's not how the system works. Residents receive a forensic evaluation annually. That forensic evaluation is used to inform the court. And if the resident is progressing in treatment and there is a belief that the resident will benefit from being in the community and conditions can be set to secure the community or keep the community safe, then a resident can be conditionally released into the community. So it's not a matter of us selecting residents for this program or for these LRAs. Residents essentially select themselves by participating in treatment, by progressing, and by demonstrating to the court that they are ready to be moved into the community and can safely be treated in the community.
I just wanted to circle back on one thing because we're getting some questions in here. Kevin Bovenkamp mentioned it at the beginning of the event. The resident is not moving in today. Our provider has some concerns with the county as far as permitting goes that they still need to work out. So I just wanted to bring that up one more time for anybody who didn't hear it. Okay, Keith, this is for you. Probably. if a convicted sex offender reoffends and harms a child, elder, staff, or anyone, who is ultimately legally responsible? Is it the state who is sued, the taxpayer, or who? Can you give a definition of gross negligence? I know we don't we don't have an AG on this call, but can you generally address that question?
So first of all, we have never had a resident on conditional release ever reoffend and be convicted. So if a resident reoffends, they are legally responsible for the reoffense and they would be charged with another crime. I'm not sure how to answer the rest of that question.
Okay, that's, again, if we don't get to your question all the way and we aren't able to completely answer it, if you can use the email address, send that to us. We are working to get those responses back. We hope to get those back within a week of finishing this up. So let's see, there was another question here. This is a good question. Brandon, this is probably for you, and I think we probably touched on it. Dante, feel free to chime in as well. And maybe we can talk about where SVPs are allowed to go with their chaperone. And how about we do that first, and then we can also go where are they are not allowed to go. Again, I'm assuming it's probably up to the court order, but if we can speak in some general terms to give people an idea of what these residents are facing.
Sure. Yeah. Thanks for the question. So what we do is conduct anywhere that they want to go that is not the court ordered things like treatment, DOC office, which also includes a particular route of travel. We do a site survey for. They put in a request, and the specialist goes out and checks out the place and decides the case by case basis which are approved and which are not.
Yeah, and Brandon touched it. I just think it's important, Tyler, to mention that it's case specific. Not all cases are the same. And I think Candace also talked about it when she talked about the chaperone.
And Keith, can you also address the levels of LRA, the SCTF versus an LRA, and it's really up to the residents' needs, so to speak?
Sure. So there's a few different levels of less restrictive alternative placements. So the secure community transition facility is the most secure. There are two within the state, one on McNeil Island and one in King County. And so these are staffed facilities by DSHS staff, and there's a number of statutory requirements that are included for the setup of these facilities. We then have the supported type LRAs, which are the staffed LRAs, which is what Supreme Living would be. So these are LRAs where residents are released and they are supervised 24 hours a day, 7 days a week. Someone is in the home at all times, and depending on the resident's needs and the court order, there could be multiple staff in the house at the same time doing one-to-one supervision. Whatever the requirements in the court order require is how that house is staffed. Then there are the more independent, less restrictive alternatives, and as Candace described, these are more like apartment type homes. They are not supervised in these homes. However, they do continue to have DOC monitoring. They continue to wear a GPS. These residents still have a resident community transition team that's around them, and they still have to comply with all of the court conditions identified in the court order.
Excellent. Thank you, Keith. So we have kind of a data question, but again, folks, if we don't have the exact data to answer your question, the numbers, We still want you to submit that. Please use the email that was listed in there, and we will personally answer that. So Keith, how many residents have been returned to total confinement after an unsuccessful LRA?
Yeah, I don't have that exact data. We can get it. I just
Okay.
don't know it off the top
Okay.
of my head. Yeah.
Okay. So everybody, it's 7:10. I'm going to take a couple more questions, and then we're going to close up for the night. And I will remind folks again, if we don't have the answers to your questions, continue to send those in, and we will get this up. So, I guess this is a question for you, Keith. Do we usually DSHS usually place residents? I'm not sure if they're referring to, I'm assuming an LRA. LRAs in remote rural areas with limited law enforcement available. Is response time considered in consultation with the agencies that would provide it? So, Brandon and Dante, if you can chime in on that as well.
So we have LRAs established, some in rural, some in more urban environments. Some are in neighborhoods. They're spread out across the state. And the court would consider as a part of the conditions in determining whether or not that LRA is appropriate for a resident, how long it would take law enforcement to respond. So if it's a more rural area, they would be able to take that into consideration.
And Tyler, and I'll let Brandon touch on this as well, but our specialists worked closely with the local law enforcement in the communities where LRAs are. And so we're communicating often with local law enforcement. Again, that initial notice comes out, which Keith talked about earlier. That notice provided to law enforcement is that opportunity and that time for us to engage. And so our specialists have good relationships with our local law enforcement. Brandon, you want to add anything to that?
No, I think that covers it. Yeah.
Okay, thank you guys. Okay, so we're gonna call that the final question of the night. So again, we just want to thank everybody for attending and participating. We posted the link to the frequently asked questions on the Special Commitment Center page. And again, if you have specific questions that did not get answered tonight, I know there was a variety of subjects, but we're going to try and personally respond to those. And we could even update it as well. So just right there, you'll see the follow-up email links to our YouTube channel. You can watch this page or watch this presentation again within 24 hours. So again, I'm Tyler Hemstreet. Thank you for joining us and sharing your concerns, and we really value these experience, time, and voices. So have a good night.